It's your village girl, Dr. Dakalo, and welcome back to the Doctor's Corner podcast. This is a medical podcast that discusses medical stories that heal, educate, and transform. And today we are discussing everything that has to do with obesity and how it affects your day-to-day. So our guest today, I'm really excited to have her on. She is a medical professional who has been in the game for 20 years. She has treated kids from neonate stage, children, young adults, and like end-of-life patients, patients that have been very sick, patients that are in ICU, patients that are post-operations, patients who have went through trauma. She's one of the team, part of the multidisciplinary team that helps with rehabilitation and also treating of patients' different conditions. She's a physiotherapist, and her name is Mrs. Mulalo Ramshala. She's a physiotherapist, she's a mom, she's a wife, she's a student. She's not just a student, she's an MBA student. Mrs. Mulalo Ramshala, welcome to the podcast.
Thank you.
I'm really excited to have you on. I'm really excited. This is like, you know, I'm really honored for you to be here.
Thank you.
I said a lot of things about you. I just want you to give us like an introduction. What do you do? What do you like doing? What are you focused on now? And add and minus from what I said.
My name is Mulalo Ramshala. I am a physiotherapist in private practice and also practicing in the private hospital. I'm also a clinical supervisor and working with neurology patients where I see those patients in the hospital, and rehabilitation thereafter. When they are discharged, I get to see them after the hospital. So in a nutshell, that's me.
You wear a lot of hats, and it's amazing to see women doing a lot of things. You're a teacher, you're a mom, you're a business owner, you are working in hospital, you are part of everyone's life, right? So just to loosen things up before we get into the topic, I want to ask you a few questions so that we can just break ice, né?
Okay.
So it's this or that. Takeaway or home-cooked meal?
Home-cooked meal.
I think I know that answer.
Yeah, you know well.
Yes. Sneakers or formal shoes?
Formal shoes.
Okay. Scrubs or formal clothes?
Scrubs. I do wear my scrubs with my heels sometimes.
You wear your scrubs? Really? Oh my God, I'll never be able to do that. Coffee or tea?
Coffee.
Okay. WhatsApp call or voice note?
Voice note.
Okay. Do you plan everything ahead or you go with the flow?
I plan.
Okay. A chilled weekend or a fully booked weekend?
A chilled weekend, even though it's not possible.
It's not possible because people want to come see you on Saturdays. Yeah? So I think we share a lot of similarities from what you said, from what you said, except that I love tea. I like my rooibos tea, and I can't cook, so take away. Yeah, so as we are now going to start talking about our topic is about obesity, how obesity is affecting people on their day-to-day, and physiotherapists are part of the multidisciplinary team that manages obesity patients, right? Because they do require a lot of rehabilitation. So I now have a question. My question is, from a physiotherapist perspective, what is obesity?
Okay, from the physiotherapy perspective, we don't view obesity as a cosmetic issue or a cosmetic problem.
Yes.
We view it as a condition.
Yes.
Simply because it affects it has a lot of side effects on a person's daily life. Obese people, they suffer from joint pain. They lose their mobility as time goes on. If you don't take care of your weight, at the end of the day, you putting more strain on your joints, which will hamper in your mobility. Yes. So that's how we view obesity. We don't see it as a cosmetic problem. It is a medical condition. That's why it needs to be treated.
Yes. So obesity has been been spoken about on a daily. Articles have been released. Treatment plans have been out there. The GLP-1s, all the other stuff, and they all leave this part and say, "Oh, just exercise." And we know that an obese patient is an ill patient, right? They need to be treated appropriately. And when it comes to their day-to-day, I just want to understand from the patients that present to you that are obese, what are the most common presenting complaints?
Okay, most of our obese patients, they come with back pain, especially the lower back pain.
Okay.
Simply because the lower back pain, the lower back, it's a weight-bearing joint that includes your knee and your ankles. So those three joints, they're the most affected areas. So when they come to us, it's because they don't come early. They come at a later stage when things are bad.
Yes.
And they don't realize that the weight is the contributing factor to those problems. So I would say the hip, the lower back, and the knees and the ankles. You can see that it's many joints. It's a lot of joints. Yeah.
And the joints that carry you on a daily. So if you have knee pain, you won't like walking. Right?
Exactly.
If you have back pain, you won't like walking. And I'm guessing because all those joints that you mentioned, they affect how you walk, how you sit. So it means that your posture also gets affected. Now you don't sit how you're supposed to sit. The back pain worsens because now you're carrying that and you're also not sitting well. So I once sent a patient to physio. I told them that we've been treating your back pain for a long time, but now you need to be seen by a physiotherapist. And the patient came and said, "Doctor, I know you said I must go to the physio. They said that I must lose weight so that my back pain can go. How true is that? Because I've been this big for a long time," right? I'm like, that is part of management. Your back pain is the contributing factor is your weight. And I think patients don't understand that. Do you think that, how... Is there any, I don't know how to phrase it, but what I want to ask you is that on your management plan, when you tell a patient that you need to lose a certain amount of weight for your back pain to resolve, are the patients that have come back to you and say, "Okay, doctor, Mrs. Ramashala, my back pain has been resolved now after losing weight"? Or is it just something that physios just like to say?
I would start by explaining how the back pain is affected by the obesity.
Okay.
Remember, when you put more weight, especially your midsection, your center of gravity is obviously going to change.
Yes.
Most of the people, they have that kyphotic posture. Because when their belly is big, their center of gravity will shift. That means your hip is going to tilt forward. That will put more strain in your back.
Yes.
And then again, it's going to affect your weight-bearing joints. So it's very difficult for them to understand that the weight is the one that is causing the lower back pain. But most of them, after we treat them, they do come and report that they can see that the physio intervention did really help. Because at the end of the day, we don't just treat the back using the electrotherapy. We use exercise. Mostly it's electrotherapy. Then at the end of the day, we have to give an exercise program for them to manage the weight.
Yes.
The other modalities won't get rid of the weight, but the exercise will be the one getting rid of the weight. So majority of our patients, they do come back and report progress in terms of their lower back pain. Again, they report, even though it's not a lot, even if you lose a kilogram on your body, it makes a lot of difference. Most of them, they do come back and report that there's a big change in their condition because they've lost a little bit of weight from the exercise prescription that they got and also from our other intervention that we use. But the most important part is exercise can manage the back
pain. Okay. So in terms of the group that presents to you, do you see that the young people who are obese, or do you see the older people who are obese? Because I asked this question because most people, young people will say, I can't have back pain when I'm old, I'm younger. Back pain is for older people. The knee problem is for older people. And you know why I'm asking this? This, for me, it's a personal thing. I was not obese, but I was a student who sits long hours. Every day I'm sitting, I'm studying, and I have this excruciating back pain. And someone said, go exercise. And I just told someone, and they're like, no, you need to go to physio. And my back pain was resolved because they taught me how to sit. They gave me a few exercises to do, right? But when it comes to obesity, what is the age range that you see? Or is it all obese patients? Is it only older people? And how do the different age groups present?
Okay. From my experience, I've seen a lot of young people coming to us with the problem of the back. Mostly it would be from 30 and above. Simply because the age group, they like takeaways. They are lazy to cook, let me say.
Like
so
myself.
So that predisposes them to gaining weight. So back pain does affect older people as well, but it is expected for them because of the bone degeneration. But for younger people, it's because of the weight gain, other than other medical condition. Mostly it is because of the weight.
And not that the fact that you're obese is because you're eating a lot, because we do have that perspective that people are eating. So some people are born in families where genetically everyone is bigger, right? And there's other people who have like hormonal problems and all that. And then the contributing factor now is that like you're not mobile, and maybe the type of job that you do, you don't walk that much. You're always sitting, but you're also gaining weight because you're not cooking. You're like any young person who's like, oh, okay, well, I'm busy. Let me just take McDonald's in the morning or whatever takeaway food that you get, right? So I understand that, because from a doctor that does refer to physiotherapy, one of the things that I see, it's also like stressed patients, like young men who are stressed, who are doing whatever projects, and they are obese also. They are coming with like back pain, like upper back pain and lower back pain. And I'm like, okay, you need to go see a physiotherapist. I'm like, oh, what are the physiotherapists going to do? I'm like, no, they have to help you because they are mobility doctors. I am not a mobility doctor. I can see, okay, you have this problem and this problem needs a physiotherapist, right? It's interesting also to see that the studies have shown that obesity is a growing thing, because even us who used to like walk long distance, we don't walk anymore. We have cars. Our kids go into cars. Back then we used to walk to school, like 5 kilometers to school. And lifestyle changes has affected a lot of us. And I'm guessing because of that, you guys see a lot of patients coming because of the back pain, right? Yes. So you did touch on a prescription. Right. Everyone sees a prescription as a doctor thing, right?
Medication.
Yes. And when we're treating obesity, we are trying to restore this person's functionality, because their mobility has been affected, right? When I send a patient to you and say, okay, go see Mrs. Ramashala, she's a physiotherapist, you're going to give them some form of prescription to manage the obesity, right?
True.
What does that prescription look like from a physiotherapist perspective?
Okay. In terms of the prescription that we give to our patients, if you send a patient to me, obviously I'm going to do an assessment.
Yes.
If it's an obese patient, we will have to check their level of fitness, because each exercise, it differs from person to person.
Yeah.
So we then prescribe a tailor-made exercise for that particular person. Remember, when you go to the gym, there are certain exercises that you can do, but the other person cannot do. But we find people doing
the same
thing or doing the same, all the exercises, whereas they're not benefiting from them. in terms of that tailor-made exercise, we look at your weight. How much can you lift? Because obviously you can't lift more than 30% of your body weight.
Yes.
If you weigh 100 kilogram, you cannot weigh that is 30%, it's 30 kg. If you're going to do the dumbbells, it means you have to distribute those weight, 15 kg on the other hand and 15 kg on the other hand, so that you are able to reach your goal. Some of the exercises, they do cause pain. Some, they do relieve pain. So for an obese person, yes, we will do the analysis. We'll also analyze their biomechanics and prescribe the exercise according to their fitness level. Yeah,
and I think that is one thing that personal trainers don't know how to do that, because they're not medical professionals, unless if the personal trainer is a physiotherapist, right? So everyone, when they say, oh, you are obese, you are overweight, you need to go to the gym, they just go to the gym and do whatever. I'm glad that you are touching that you need to be assessed first to see what can you do and what can you not do. Because I'm guessing if someone goes to the gym and then exercise the way they're not supposed to, it can cause more harm. They come with worsened back pain because they were lifting more than they should. They come with injured knees, come with injured ankles because they've been doing exercises they're not supposed to do. And my question now is that what are the worst case scenarios of people who started at the gym before they start with the assessment?
Okay. Some of the people that started at the gym before coming to us, we have seen a pattern of sciatica. And you know what is sciatica? Which is the compression of the nerve.
Yes.
That happens because a person will go to the gym. They have a lower back pain. And they use the gym to manage that pain. Lifting a heavy weight, that is putting more pressure on the spine. At the end of the day, the pain is going to get worse. So when they see that, no, the exercise at the gym is not working, they then come to us.
Yes.
Then that's when we realize that, oh, okay, you've been going to the gym. What type of exercise are you doing at the gym? Then they will explain, okay, I'm doing the lift. I'm lifting. How many kgs are you lifting? And then how much do you weigh? From there, we start analyzing the mechanism of that injury. How did it happen?
Yes.
So, yeah, most of them, they do come. They go to the gym and then come to us when things are not working at the gym. It's best for them to start with the physio and then we can prescribe the relevant exercise to them. That
and you can
beneficial.
Upgrade as time goes.
Yes.
When you come back for reassessment, you say, okay, now you've developed the skills, then you can go to the next one. You can now lift whatever that you can lift.
Exactly.
Oh, okay. That's very interesting. There is I think a study that I saw that there's people that are in this exercising facilities that actually didn't even get anatomical training, and they don't even know what muscle is which and how does the muscle work, right? So that's why you need to be assessed by a medical professional. You mentioned a condition, and that condition is one of the most common conditions that young people present with sciatica. I mean, that is called sciatica. I feel like we need to explain what sciatica looks like and how does it feel like, right? Okay. What will the patient say to you that will say, oh, well, that is sciatica?
Okay, most of the patients that will come to me and then I picked up some symptoms, they will tell me that there's a pain on their back. It runs through the leg up until either the lower limb, the calves, and the numbness under the heel, and also sometimes tingling sensation.
Yeah.
That's when I will say, okay, let's do some tests to check if this is really sciatica. So we have a certain test that we do as physiotherapists to check if it's really the sciatic nerve. And also another way is to send them for X-ray so that we can see if there's any compression or the narrowing of the disc. So other than that, as physiotherapists, we use our test to check whether it's sciatica or not.
Okay.
So, and sciatica is the compression of the sciatic nerve, simply sciatica from the sciatic nerve. Yeah, that's how we will simply define sciatica for someone to understand.
Yes, I have seen a lot of patients that come with sciatica. Yes, we can try as medical doctors to give you some neural pain relief and all that. But essentially, physiotherapy is one of the best treatment you can get for sciatica. We can give you whatever, but if you don't go see a physio, you're going to complain forever because I'll give you this, I'll give you that. And then the pain is not going to go away because we're not resolving the problem that is the nerve impingement, right? Which could be caused by your posture, by injuries and all those things, right? So I want you to tell me what are the there's other things that I've heard from patients that I'm like, well, I think I also thought that physiotherapists are for. I want us to break myths. What are the most common things that you hear about physiotherapists that are not true?
Okay, that we are massage therapists. We are not massage therapists. If I still remember, we did massage, I think, for 4 weeks. Massage is part of our modality. We have a lot of modalities that we use to treat different types of conditions. So massage is one of them. But we are not a specialist for massage. We just incorporate our treatment with massage. Yes, that one.
I think those are one of the common
with a lot
ones.
of people that we are not massage therapists. We are physiotherapists. We just use massage as part of our treatment modalities. Yes, I can see a patient and not massage them. Yes.
So, is there any other misconceptions about
physiotherapists? That we can fix what is broken?
Yes, definitely not. There's the right people for that.
Because we do have patients who will come with broken bones, thinking that we can fix the broken bone. So physiotherapists don't fix bones just because they say we are. Okay, Dr. Wamarapo, what can I say in English? Yes, so we don't fix the bone. We can only help you after the bone has been fixed. Yes.
Okay. And then can I come to a physiotherapist once and that's it?
It depends.
Okay.
It depends. There are certain conditions that we can see once and then you don't have to come back.
Okay.
I will make an example. Okay, if you come to me for a sputum induction, I will induct and then you don't have to come back. But there are those that you have to attend every week. Let me say even every day. Like if you have a chronic back pain, obviously I will have to say, no, not a chronic, an acute back pain. For an acute back pain, it's easier to manage when it's early. So we'll require you to come every week until we normally give them 6 sessions to say, okay, after this 6 session, if there's no improvement, we're going to send you for second opinion, which would be maybe your orthopedic surgeon. Yes.
So I have seen a lot of obese patients who come with like ankle sprain, right? And I tell them that, you need to go to physio. I'll give you painkillers and we'll immobilize the leg, but you need to see a physiotherapist. So in my practice now, I do see a lot of ankle sprain patients. They come after a fall on the stairs or wherever. They don't have any bony injuries, right? I will immobilize, tell them you need to go see a physio tomorrow or whatever, whenever the appointment is, right? So my question is, because I never get to see those patients most of the time, my question is, how is the recovery for obese patients with ankle sprains?
Okay. In terms of the ankle is a very sensitive joint. It takes a while for for an ankle sprain to recover. It also depends on the ligaments that are involved, because there are other ligaments that needs surgical intervention, and that's when we come in after the surgery has been done. So the recovery is good if the person decided to consult in time, because some people, they will stay, especially with obese people, they will stay with an injury for quite a long time, thinking it's nothing,
minor,
or it's a minor thing, it's a minor, up until they can't take it anymore, especially when they gain extra weight. It gets worse, and then they come to us, because you can get a ligament tear from being overweight. It's easy for obese people to fall, and then when they fall, that's when they get these injuries where they either they fracture the ankle, or they sustain those ligament injuries. So the recovery, if they consult in time, it is good. But if they come late, there's already inflammation. So that will take a bit of time for that inflammation to subside. So meaning we will treat them for longer, but at the end of the day, we do get positive feedback in terms of the recovery.
So let's say a patient, right, was operated on, and the orthopedic surgeon says, okay, I'm discharging you, you're going to go to physio. And the patient decides, I'm not going to go to physio. I'm not going to... people think that physio is for exercising and massaging. What happens? What are the long-term repercussions of someone not being rehabilitated after an operation?
Okay, yeah. After an operation, remember there's adhesion, there's inflammation there. If you don't consult the physio, or if you don't do anything with that injury post-surgery, they're going to develop contractures. There'll be muscle wasting, which will hamper in mobility. So they will end up not being able to walk due to that. So it's very, very important that after the surgery has been done, immediately the person must see a physiotherapist so that we can start with the rehabilitation. Really? Remember, after that, your balance is not there. We have to train you
how to go back to...
we have to train your balance. Use the proprioceptive exercises to get you back to normal, get
state,
you back to working again. Because if you're going to depend on the crutches or the moon boot, those things, they take away your balance. Once you take away the crutch and start walking alone, you're not going to make it, because your balance is already gone, because you were depending on the assistive device. When they take away the assistive device, you are left with nothing but your other leg, which is only one. So you need physiotherapy rehabilitation as soon as possible. Yes.
So when you say, for someone who's sitting there thinking, what are you talking about when you talk about atrophy and like immobility and all that? From my understanding is that if you don't use something, you do lose the muscle mass, right?
Exactly.
So if you are injured on the elbow and now you are on a sling for however long that you are on a sling, you're not using the muscles here, you're not using the muscles here. This hand is the one that's working. At the end of the day, if you don't go back for rehabilitation, you're going to have a smaller hand and a bigger hand. You're going to have a restricted joint that you cannot do for your full range of motion, right? That's exactly what you mean. If you're like this, you develop a contracture that you can't go fully and use your arm fully because there is a contracture there, right? So it's quite interesting that a normal patient, and I think from a perspective of a doctor, we don't dive deep into and explaining to the patient the importance of rehabilitation and going back to the physiotherapist, to the OTs and our other multidisciplinary team, right? Because we work as a team.
Exactly.
I will see a patient today and not see them again. Right?
True.
Do we need someone else to follow them up, to help them go back to their their original state, right? So I want you to just tell, as we're concluding, to tell a patient that's sitting out there, or a family that's sitting out there worried about their family member who has gone through, who has had an injury or whatever, not knowing how can we help this person go back to their original state. What would you say as part of the team of rehabilitation to that person or to that family?
Okay. It's very, very important for our people to understand that as the multidisciplinary team, we don't work alone. If they have someone at home who's suffering from either poor mobility due to either injuries or stroke, or they've been in a motor vehicle accident, but they already given up on the person to say no one will help. We are there to assist them. Rehabilitation is very, very important. I cannot see the patient alone. I need an OT to be there. I need the podiatrist to be there. I need the doctors to be there. So we work as a team. So a lot of our people, they don't really understand our profession, because they will think if they take a patient to physio, there's nothing that the physio can do. They will look at the condition and say, but what can they do?
Stroke patients can walk again.
Yeah, especially, with the example with the stroke patient, we do have stroke patients that are being discharged from hospital to home, but they were told that after you have to see a physiotherapist, you have to see occupational therapist. They don't do that because they don't see it as, when they see that person, they see that person as a disabled person, someone who can no longer do anything for themselves. But we as physiotherapists, we work together with the OT, we work together with the speech therapist, because some of them, they lose their speech. So we work as a team to rehabilitate those people so that they will be reintegrated back to the community. So it's very, very important that our community understand our role as health professionals and the impact that we make to our people. Because our aim is to see them as independent as possible. You can have stroke and still live a normal life. But if you don't consult your healthcare professionals, you will end up with a person who's not mobile, who can't do anything. Some people, they will even tell you that I'm going to resign, or I'm not going to go to work because my husband had stroke. They can't do anything for themselves. It means I have to leave my work and attend to my husband. Whereas attending physio and OT and other multidisciplinaries will make that person independent to a point where they can be on their own and do everything like us.
Yes. And it's called rehabilitation for a reason.
Yes.
We are rehabilitating you. We're giving you back your independence, right? So I am really... like this conversation, we can go on and on.
True.
We can discuss other conditions. We can discuss how physio impacts children who are disabled, how physio is not just about injuries and exercising. Physio can change people's lives.
True.
I've seen people at their worst state, and after having multiple sessions with physios, and you're like, is that you? You couldn't even move your body, you know? It's a big topic that we can't have we can't
True.
have the whole conversation today. Thank you.
Thank you.
Thank you for really coming. Yeah, I'm really glad that you came and people are able to understand. Like, you're giving them perspective of what physio do. It's not just a massage. Yes, we don't just go there and get stretched and then that's it, right?
Exactly.
You do have a bigger impact, and your treatment might not look like as a pain relief today. We're giving you a painkiller and then it kills the pain today.
True.
It's more, we only
it's a long
see
term.
after multiple sessions, or, actually, I can now walk, I can now do this, I can now hold a cup myself, Thank you, Mr. Ramashala, for joining us today. I'm really excited about this episode, and I hope everyone who is at home watching enjoyed the episode the same way we did. And if you have questions, if you want to share more stories about how a physiotherapist has changed your life, put it down below on the comment section. Like, subscribe, share with your friends. Go consult at Mrs. Ramashala's practice, or you can contact her on social media at Mulalo Ramshala on both Instagram and TikTok. Just know that your body does communicate anything that is happening with it. The same way it has pain is the same way it will communicate when the body is a lot on the bones that are carrying it. So thank you for joining us. I am your village girl, Dr. Dakalo, and this is the Doctor's Corner podcast. Thank you. Bye.